Welcome to Direct Primary Care Benefits Podcast, your resource to understanding how DPC and the direct care model is fixing healthcare for employers and individuals alike. Learn from the most innovative and disruptive business executives, brokers, physicians, and healthcare influencers that are in the trenches, changing the way employee benefits are being administered across the country. I'm your host, Brett Shoemaker. Well, welcome everybody to episode 5 of Direct Primary Care Benefits Podcast. This is your host, Brett Shoemaker, and I have got a very awesome and exciting guest today for the show. And I've got none other than the Dr. Roger Moczgemba from San Antonio, Texas, and the Direct Med Clinic. And super excited about our conversation today. So welcome to the show, Dr. Roger.
Well, thanks for having me, Brett. I'm very happy to be here. I'm excited to be here and talk about what we do. We all love direct primary care if we're in the business, and we all love to talk about it.
Yeah, absolutely. Absolutely. And so what we're going to be talking about today for all of our listeners, and, just to reiterate, Dr. Roger, as you already know, we talk to healthcare brokers, insurance brokers, other employer groups, and really just anybody who is in the healthcare, direct care space that understands that our healthcare system is broken and we are out and on a mission to fix healthcare. So what we're going to be talking about today, as you and I kind of strategized, was healthcare versus health insurance, and really the false sense of security that people think that they have with insurance, because they think that card in their pocket relates to health care. And you and I both know that it really is just, as the free to care movement would say, the healthcare cartel that's just kind of redirecting money and charging way too much for the care and not even giving the care necessary to really create overall health so that we can deliver health care. So I'm excited to dive in here. And before we do that, though, Dr. Roger, I want to talk a little bit about your background, because I know when we talked offline, you kind of share with me a little bit about what your background was and how you got introduced to the direct primary care model. So why don't you dive in and kind of just tell people a little bit about your background and how you got introduced to direct primary care?
Yeah, okay. I'm going to go way back for a minute. When I was first starting my practice back in the 1990s, the internet revolution was spinning up, and I started a startup business for myself there to let people come in and see me, a new doc, and I was trying to build my practice. So I'm an innovator is what I'm trying to say. And if they would see me, book an appointment online, pay for it up front, I'd see them on time. That was the start of my entrepreneurship in medicine. That didn't spin up because I think it was before its time, and due to some other stuff beyond my control with a partner, didn't spin up. But then that introduced me to the opportunity to help start a nationwide telemedicine company called Teladoc, which I was the first doctor doing that. I was the president of the Physician Association of Teladoc for the first 9 years. Then that led me to be able to help another company, a private company, start their own telemedicine service line. I was their medical director for a few years. Then I came across the DPC model when I was working in an urgent care in northern Utah, and I thought, hey, wow, this is really cool. The folks that pay for health care can actually enter into a direct relationship with the folks that are getting the health care.
Hey, what a genius concept, right?
Wow, like, really? This is so refreshing. And it was a wonderful environment to practice in, and I loved it. Along the way, at that time, I went ahead and got a master's degree in healthcare administration, and that opened my eyes even more. And then that led me to starting my own clinic, direct primary care clinic in San Antonio. So that's a little bit about my background. I've always been a innovator and entrepreneur. Just like to do things, to find a better way to do things, And
Absolutely.
So what a better way than to do things directly if possible? I mean, isn't that part of just the American way, is just doing things directly? I mean, we always see these kind of opportunities, buy direct, buy wholesale, this wholesale that, So where did we go wrong in healthcare?
Well, we started to go wrong in healthcare in 1987, right? Whenever we passed whatever federal bill that allowed people to get kickbacks, the only industry to get kickbacks, and yet we wonder why we're fighting this healthcare cartel, right? But you and I got to spend some time together with Mr. David Ballot over at the Free to Care conference. And real quick, before we dive in here to some questions that I had, and really very impressed with your background. A couple things I just learned and you going through that I didn't learn before. So I'm excited to dive into that. But first, what did you think about the Free to Care conference? I was really impacted in a positive way and really got filled up. How was your take on that?
I went to a lot of conferences this last summer, and what I really noticed from the Free to Care conference, there was not a lot of people there, but the people there were really big-time influencers. That was what I took away from it. That's what it was.
Absolutely.
I was really impressed. I was privileged to be there and part of the Free to Care conference this year. It was amazing.
Let's dive in here. So I had no idea that you were actually involved with the original teledoc. So that's pretty exciting stuff, right?
It was. It was early on. It was before its time in a way. And for many, many years, we kind of flew under the radar in taking care of people that way. And then eventually, as a good thing evolved, it got to be more and more noticed. And then when the pandemic hit, wow, it was a good thing that it was in place the way it was, because it helped countless thousands of people, during the pandemic. And it really just, telemedicine in general was out there during the pandemic, which it was a good thing because it helped thousands of people.
Yeah, help people really get into understanding that technology doesn't have to force you to be in the same room with somebody, and allowed really what I believe from a business standpoint, really create more efficiencies overall. Would you agree with that?
Yes. Let me just say it this way, that it's not so much about the technology, but it's access to care, access to a doc that is allowed to use technology. And the reason I say it that way is because technology is just a tool. The real magic is really with the contact. It's the access to the doctor. Now, the doctor knows how to take care of patients, and they're going to know what kind of technology will work and what kind won't, whether a text message is enough, or a phone call, or a virtual, like they need photos or they need a video visit. And so it's really about access. And to say it another way, several years ago, before the pandemic, I was at a American Telemedicine Association convention, and somebody said something that stuck with me. He said that our technology has far outgrown our reimbursement strategies or reimbursement mechanisms. And that's really what we're talking about. If you recall, during the pandemic, those regulations were relaxed, allowing people to call their doctor on the phone or talk to the doctor on the phone, and then the doctor could bill for that and get reimbursed. Otherwise, there was, doctors just wouldn't have had the ability to talk to their patients and get paid for it.
Yeah, absolutely. So even though the pandemic obviously created a lot of lives lost, unfortunately, our prayers and thoughts go out to all those families, but there's a lot of great things that I think laid the groundwork for where we're at today. And I don't know about you, but I'm feeling a really sense of urgency and a vacuum almost that's being created because employer groups are starting in the droves to understand that there is a different way. And it's really forcing insurance brokers and employee benefit brokers to start to educate themselves. And versus us being, pulling people along and dragging people along, now I'm noticing that people are kind of raising their hand and saying, hey, we need to have this conversation. Let's talk, right? I don't know if you guys are seeing the same thing.
Absolutely. Absolutely. We're living that right now. And part of it is because the word is getting out. Another part of it is because transparency. And so the brokers are, I've heard in the last couple of months, two fair sized employers tell the brokers, hey, we want this. You look at a way to make it happen.
You figure it out, right? And that's where we come in because we have laid the groundwork. And I say we, but really and truthfully, between, folks like Dr. Goyle and yourself, I mean, you talk about you being an innovator and entrepreneur. I would consider you a businessman because not only have you gotten past almost 5 years doing this, you're up to multiple locations now. You've got 2 physical locations, is that correct? And then also some near-site, on-site clinics. So you guys are rocking and rolling over there.
Right. Yeah. Part of our model, part of our operation in San Antonio is a couple of locations, and then we have a part-time on-site location, and then for one employer, we function as a near-site clinic. So I think we kind of got the continuum covered.
Absolutely. I am so excited to see what you guys are doing and the continued growth. And I know you've got a great marketing team behind you with Shankar and all of the great things that they're doing for you guys. And so just a great partnership. It's been great getting to know him as well. And so let's dive in here, Dr. Roger. Healthcare versus health insurance. What would you say to the people that are out there listening, any employers, any even maybe employees, or just everyday average folks that are looking for healthcare? What would you say to them about why healthcare and health insurance have been kind of misconstrued over the years?
Well, first, let me just say this. Now that we've mentioned there's a difference here, I would just invite everyone to think for a minute. Next time they hear anybody talking about healthcare, think in your mind, are they really talking about healthcare or are they talking about health insurance? So most of the time these days when people are talking about healthcare, you'll find that they're really talking about health insurance. Now, and to answer your question, health insurance is what's expensive. There's the high premiums, there's the high deductibles, and all that. But once you learn about direct access to a doctor, like direct primary care, or if you're an employer, directly contracting with a clinic, then you'll see that, oh wait, healthcare is not that expensive. Access to a doctor or a clinic is not that expensive. It's health insurance which is expensive, you see. So in our situation, when Direct MidClinic directly contracts with an employer, we essentially are partnering with them, and through that kind of direct agreement or partnership agreement, now we are able to offer them cash pricing on imaging, which we have available to us, and our rates on labs. And so we pass that on to the employer. And so the employer doesn't have to go through their insurance, or the employees at that company don't have to go through their insurance, where there's a markup on all of those services, which can be pretty substantial, you see.
Absolutely. The amount of savings on imaging and labs is just unbelievable. I remember, when I first started looking into the pricing, when I got involved in the healthcare industry about 18 months ago, I was blown away at seeing the cost of labs and imaging. And many times, folks end up paying what is called co-insurance, right? And most companies are 80-20 co-insurance. And what I found astounding is that the 20% co-insurance that folks were paying in most cases not only was more expensive than what it actually costs, a lot of times just their co-insurance was 2 and 3 times what the labs or the imaging actually cost before the, big insurance companies got the rest of the cut. It's just unbelievable. Isn't that crazy?
Mm-hmm. It really is. It really gotten out of hand.
Yeah, I mean, we have a slide that we show employers when we're kind of showing direct primary care and the benefits of it. And I think I think it's like $1,400 what it was costing through being billed through insurance. And after we applied our discounts, it was like, I think $140, $150. And when you think about that, I mean, it's literally 10 times markup what the insurance companies are charging versus what it actually costs. And not only that, but to your point, right? We shouldn't be using health insurance to, handle our health care, right? We have car insurance to cover, our car in case we get into an accident, but we don't use our car insurance for oil change or tire rotations or, regular vehicle maintenance. And at the end of the day, right, like everybody needs a relationship, like you mentioned, that access, that time with the doctor so that they can get their health care, which is actually that preventative maintenance and that ongoing maintenance like you would on your vehicle, right?
Yeah, and let's just take that analogy one step further. Let's say that we used our car insurance to change the oil. Well, now if I'm on a limited income and I've got my car insurance, I might get to the mileage mark or the time mark that says, well, I need an oil change. But wait a minute, I'm running tight on funds this month, so I'm going to put that off. My car's running fine. I don't need to change the oil right now. So you go another month, and you don't take care of the maintenance on your vehicle until you go on a trip or something and it breaks down, or the motor seizes up. Wow, then it's going to be a huge expense for you, So that's a similar analogy as to what happens in healthcare, literally, when people don't have affordable access to care because they think that, well, it's true in so many instances, that the only way to access a doctor sometimes is with health insurance. And it's sad to see that it's come to that, I think there's going to be a lot more direct primary care doctors, and that'll be a great, great positive for everybody to know that they don't have to put off their health care. They can go in early, and not wait till the last minute.
Absolutely. And so, Dr. Roger, one of the things I like to do on this podcast, for employers and for individuals that are out there listening, brokers, whoever it may be, is really share with them resources, right? And you and I both know that at the end of the day, we could give you all of the resources, but you really need an advocate. You need somebody, and when I say somebody, I'm talking about a primary care doctor that is practicing medicine in the direct primary care model, because they're the ones that are going to use and help steer and guide you to that best and affordable care, right? But I actually just had Dr. Dickerson on with Green Imaging, and obviously there's another broker that I was in conversation with, a good friend of mine named Crystal Wilson, and she was talking about some lab resources that she uses. So what are some of the resources out there that you would say to listeners like, hey, this is a perfect example of a resource that we use in our clinic that most people have no clue about, but it's one of the components that really makes the magic happen. Anything that you would like to share?
Yeah, well, green imaging is definitely one of those, and most DPC docs know about the green imaging, and employers should know about that too. Brokers should know about that. Let's see, some other resources that many DPC doctors use is an internal consultation service where if we're getting kind of into an area where a patient's care might be complex and bumping on the edge of needing a specialist, we can reach out electronically to a specialist through the service, and then within a matter of a few hours, we get a response back from the specialist giving us some guidance on what to do with that patient. And so in that case, you see, having access to your direct primary care doctor can keep a patient from having to go see a specialist, which would be usually another big out-of-pocket cost and entail probably a lot more testing on their part. So that's another resource.
Awesome. I appreciate you sharing that, Dr. Roger. Now, let me ask you this, because, when folks start hearing and they hear about direct primary care and they hear all of the deliverables and what they get out of it, and they see the concierge level access that they have, they start to wonder, and in their minds, they think, wow, well, I don't have this insurance card anymore. Like, how in the world is this going to cover me for those big, bad, ugly things? And so obviously you and I know there's different health shares out there, medical cost sharing utilities that are used. And not only that, but you can piece together a DPC doctor as the foundational coverage on your health plan when it comes to, just standard sick care and ongoing health coaching as well. But what would you say to those folks out there that start to get a little nervous and they're like, man, I want to make this shift. I want to make the change, right? What do you share with employers on you guys' front in terms of these challenges that I'm speaking of?
Yeah, that's a great question. So if we're posing that question for an employer's benefit program, I would say that they need to be in touch with a knowledgeable broker, because that's really their job, is to know what resources are out there to put in place after the DPC core or around the DPC core. Many brokers are incentivized by the large insurance companies to keep a company in a fully insured model. So it might not be in their best interest to do that, but it's definitely in the best interest of the company for a broker to kind of deconstruct that fully insured plan and customize the approach that's going to work best for the company. And so some brokers might just not know how to do that, or they might not have the background or the resources. So, but there are resources that the broker has. So it needs to be a knowledgeable broker.
Absolutely. That couldn't be any much further from the truth to what you're saying. You got to have a knowledgeable broker. And I think a lot of times companies, when they think about, self-funded or level self-funded, they get a little bit scared, right? Because they're thinking, oh, well, hold on for a second. That means that we're going to be footing the bill. And the reality is, even when they're with the carrier, right, they're pretty much self-funded, because at the end of the day, they're still responsible to deliver that care, right? And so do you want to just kind of maybe elaborate a little bit on that and share with employers that are listening why it's not really that scary to go self-funded?
Well, I'm not a large employer, but I can definitely appreciate their position, because if you have a lot of people are in the mindset like, I want my Blue Cross card, or I want my insurance card, they have to take care of their people, and their people have to perceive that they're being taken care of too. So it is kind of a sensitive topic, and it's kind of for an employer that might have a lot of issues going on in their industry. They shouldn't have to worry that much about healthcare, and we all know how complex it is. And I say all that to say probably the best thing that an employer can do is to know that, number one, to know that there are options out there, and then to look for the right people to explore those options like uh, a, an experienced benefits consultant or broker. And then another thing is to get to know a DPC doctor in the area or in the areas where your employees are, and to explore or start a relationship with that DPC doctor. And I say all of this that way is to start to open your mind a little bit and then start taking some baby steps, you know. And we're not asking somebody to just kind of go off in the dark or you know, just throw mud against the wall and see what sticks. No, an employer's got to be careful about taking care of their people. But what they're going to find is more value. Each little baby step they take, they're going to find some value. And the more they take, the more they're comfortable with that, they'll take a bigger step, and then they'll find more value. And they can work it in. There's ways to do that. And that's what I would say, is to be open-minded about it and start taking some baby steps with the right people.
I love the way that you put that. Take the baby steps, and with every baby step, there's going to be value. And you could not, again, be any further from the truth, because here's the reality, right? Once they start exploring what it looks like and the level of care that they're going to receive, then they start saying, wow. I think what happens, Dr. Roger, from my experience, is when these employers actually start, you know, peeking behind the curtain and seeing what their people are going to get and understanding all of the cost containment strategies that are really implemented just by the very nature of direct primary care, they start to connect the dots and say, wow, we have got to figure out a way to do this because our people need this. And so I just love the fact that we're able to deliver care on that level. And so let's talk a little bit about you guys practice and how you do it there in San Antonio. Do you guys accept any insurance at all? Or are you guys 100% subscription based and only do your members specifically?
Yeah. So I kind of alluded to the way that we got started, and it was going to be kind of patterned after another practice. So the way we got started was as a hybrid. So that means we started out taking insurance, and so we still do, just for a handful of people because they started with us. But we're not taking any new insurance. That's not part of our model. We're all direct care, basically.
I love that. I absolutely love that. So you guys are definitely, practicing what you preach, and I just can't tell you how much I appreciate you guys for doing what you do on a daily basis. And so you've got a pretty fast growing team over there in San Antonio, and you guys are obviously doing some great work. What would you say, Dr. Roger, that is the thing that gets you up out of bed every single day and to go and practice medicine the way that you do? What do you think is the biggest driver for you?
Oh, wow, that's a great question. No one's asked me that before. But I feel so energized these days in my career because there's a wonderfully refreshing way to practice medicine where you can slow down with each patient that you see, talk to them, spend time with them, and then it's affordable, okay, and it's accessible. So I love just talking about that, and I do a lot of extracurricular stuff outside the clinic because I'm so excited about it. I just want to spread the word, and I think because I do that, and I'm kind of a innovator and entrepreneur at heart. That's how I met you. That's how I got connected with Free to Care, and that's why I do all these other things. And I'm out talking to employers and people all the time about it. And so really what gets me out of bed and motivated is just this wonderful model and taking care of people. You know, like a couple of months ago, I was in the clinic and a patient was checking out who'd seen one of the other clinicians there. And so he looked over and said, "Hey, Dr. Roger, I'm just so glad that you're here because if you wouldn't be doing what you're doing and have this clinic, we wouldn't have anything." So it's that kind of stuff that is really heartwarming. And then another thing that not long, well, when the pandemic was winding down, we were looking back at some statistics, and we looked on this one employer that we have, and we were really tight with them and told them, look, if you have anything COVID related or respiratory related, let everybody come to us and let us manage that. And when we looked back on what happened, nobody from that company went to the hospital with COVID, and nobody died from COVID. So it's that kind of thing that is motivating.
Absolutely. Absolutely. Well, you know what? I got to tell you, I appreciate your answer so much, because what you basically just told me is that you are super passionate about this model. And really what that translates into is you care about your patients. You care about delivering care and delivering results. And you know what? I know how I feel every day to tackle this solution of fixing healthcare. And I can only imagine what you as a practicing physician and founder of Direct Med Clinic feel to be able to deliver that. So congratulations to you. Congratulations on all the amazing work that you're doing. And I just want to encourage everybody that's listening, if you're in the San Antonio area or even beyond, make sure that you go to directmedclinic.com. And that's just simply directmedclinic.com. Or go check out Dr. Roger Moczgemba at LinkedIn, and make sure that you follow him and reach out. He is definitely very approachable. And Dr. Roger, I got to say, you know, not only did you take the time and energy that it takes to be a doctor, which again, I just applaud every single doctor that, you know, direct primary care or not, for really taking on the responsibility and the amount of schooling necessary to get that classification. But above and beyond that, for you to go back to school and get a master's in healthcare administration, wow. I want to just sit in a room with you and pick your brain even more and learn all the things that you learned through that experience.
Well, thank you, Brett. I'm so happy to meet you, and thank you for inviting me onto your podcast so we can have a good heart-to-heart chat and just talk about options, because there's, you know, what we find is that people think there are no options, but there are options to affordable care. And you know, you and I both, we just want to get what might not be a good fit for this person might be a good person, but options, right?
Absolutely.
What works, right?
Options are endless, and they're growing every single day. I'm excited about the Direct Care Texas initiative that just launched out of the Free to Care event, and excited about how we're going to be able to help grow that and expand that, and really just continue to partner together to spread the word of direct primary care and how it's helping employers change and administer employee benefits like they really should be. So, Dr. Roger, I am excited to have a sequel to this, and also put it in a video format so that everybody can put a face with the name and really see the amazing work that you guys are doing out there. So again, I appreciate you so much for being on the podcast today, and looking forward to more conversations in the near future.
Thank you, Brett. I look forward to connecting again and doing this again.
Awesome. Well, guys, that is going to sum it up for episode 5 here in Direct Primary Care Benefits Podcast. This is Brett Shoemaker, your host. And I got to just say, if you have gotten value today from myself, Dr. Roger, any of the information, please share, subscribe, follow, give us a rate and review, because what that does is it helps more people hear the message of educating folks on how to fix healthcare. And so with that being said, I want to thank each and every one of you for listening and helping us on our mission of fixing healthcare. This is Brett Shoemaker. Have a great day, and God bless.